Hello. I am recording live here on this Friday. My dad couldn't be here, so I brought him along. Trying to head out to Florida and escape this winter. It's actually starting to snow here in Noblesville, so thank you for joining me on this Friday of AEP. Give me some love if you are on live, and let me know where you are tuning in, which means if you are on Facebook that you are not working, which means you are probably tired and you need a break. So thank you for all your hard work. I know I need a break, which is why I'm sitting here trying to figure out what I'm going to break with. Is it going to be chocolate or ice cream? That's my go-to break. I want to talk to you guys today about Medicare scams. And I can't really talk about this enough. I don't know how much time you have when you're with your clients, when you're doing presentations to really kind of share some information that's helpful to them. And you might not. This might be information that you need, content that you need to share in your newsletters, in your emails, that you might do articles for your local newspaper. I'd like to shout out to Phyllis Becks. Phyllis writes an article for her small town newspaper. It's really good. And she sends them to me, and I greatly enjoy them. It's a service to her community, and I'm sure it helps her drive business. She's a good agent, and she makes probably a good referral lead business off these articles. So the kind of stuff I put in these videos, one, I want you to share it with your clients to help them, is straight up to help them avoid being a victim. But two, I want to give you guys content when you're sitting there thinking, what should I put on my Facebook? What should I put on my other social media platforms? What should I put in my client newsletter? This is the content. You guys push it out and make it your own. So today I'm talking about Medicare scams. And as you can see in the background, I got Lenny, my butler, here also to help me. I want to talk about a scam that happened recently, which is still happening. And that is people calling people that are on Medicare. And they do it during AEP because people during AEP know this is something. They don't really know what has to happen. How many of you have had somebody that says, I have a Medicare supplement and I know I have to change it now, or this is the only time I can change it? If you're in the comments and if you've ever had somebody tell you that they can only change their Medicare supplement during AEP, thumb me up or give me emoji or somebody crying tears or something like that, because it's so frustrating because that's completely wrong. As you know, AEP involves Medicare Advantage and Part D. It does not involve Medicare supplement. If you have a Medicare supplement, you can change your plan anytime. You could change it several times a month with some companies, and you could change it every month with minimum with every company if you can pass that underwriting. It doesn't have anything to do with AEP. So people call and they say, hey, this is Linda from Medicare. I'm sure you were expecting my call. It's that time of year again. And, you know, the unsuspecting senior is like, yeah, of course, I'm not stupid. I know it's that time of year. I watch TV. So he's like, and she'll say, I want to give you my Medicare number. So she'll give him some fake ID. Do you have a pen so you can write this down? So he's thinking, wow, this sounds legit. Okay, so he may write it down, but if you're like me, I don't write it down. You like go, yeah, I'm writing it down, but you're not getting out of your chair, right? So, and then she says, well, I have your name. Are you Sylvia Ann Gordon? And he will say, yes, I am. She will say, is this your current address? 20236 Hague Road, Noblesville, Indiana. He'll say, yes, it is. And then she'll say, okay, I need you to pull out your Medicare card and I need your Medicare number. Now, a savvy consumer with an old card. Now, the new cards started coming out, but they're not all out yet. They won't be all out till the end of 2019. In April, the first wave of people got theirs, but most people don't have it. Most people in America, the 70 million seniors, have the old Medicare card that has their Social Security number as their Medicare number. So when they say, I need to verify your Medicare number, and that client gives that number, boom, they are now going to be a victim of identity theft. So what we want is we want you to teach them, hey, Medicare doesn't call you and ask for that. You know, the bank doesn't call you and ask for your routing number and your check. Don't, if you think somebody's calling you from Medicare, get their number, call them back. Now, When this guy called this person back, the number didn't work, but they're getting really smart where they set up call centers. So they give you a fake number. And then when you call back, it says, hello, Health and Human Services Department of Medicare. How can I help you? Because they're all in the same room with this scam working. So you got to warn them that the number for Medicare is 1-800-Medicare. So if it's any other number, it's a scam. And Medicare wouldn't ask you anyway. What you really want to do is you want to really put it into your client's mind that it's not an inconvenience to call you. If they have a question, if they have any tiny doubt, any tiny bit of wonder if this is a scam, that they call you. And the nice thing about working with retirees is they're very polite in general. And if I talk to them and they tell me this thing happened, I'll say, well, why didn't you call me? And they're like, Sylvia, I don't want to bother you. I know you're really busy, which I respect that. But that's my job. That's what I want to do, and I want to do it well. And I want to make sure you're taken care of. So if it has anything to do with Medicare, you see on the TV, the news, somebody calls you, call me first. Don't do anything. Now, part of that is you want them to rely on you so they don't get scammed. And part of it is you don't want somebody else stealing your business. A call center, one of the biggest call centers in the country, you know who you are, I'm looking at you. They called my aunt last year. So I was already talking to my aunt about buying a United Healthcare PPO plan. And we had gone through the whole thing. I'd sent her the summary of it. She had everything. We don't live in the same town. And then I guess after I got off the phone, I was going to call her back, or she thought about it for a couple of days. So after I got off the phone with her, she gets this call and they said, hey, it's that time of year again, my aunt's name. And it's time to get you enrolled in United Healthcare. So do you have time right now, or should I call you back later in the day? And so she's thinking I triggered this because I was going to sell United Healthcare. So she thought it was me or somehow related to me. So she starts going through, giving him her social security number and her Medicare date and doing everything. And then luckily something happened that she got interrupted. She said, look, I can't do this right now. I'm going to have you call me back on Thursday. Can you just call me back on Thursday at 3? So in the meantime, I don't know any of this is happening. And I call her back on Wednesday. And I said, okay, are you ready to get this started? She goes, oh, I already started it. What, your people called me and I already started filling out the application. I'm like, oh my God. So I think she's getting scammed. And then I found out who it was because they sent her an email, and I found out who it was. One of the biggest call centers in the country. I'm looking at you. If you want to know who the call center was, you can put it in the comments and I will tell you. But that's what they did. So I said, when they call back, will you record them? I want to hear what they're saying because I think this is illegal. They're not saying I'm from Medicare. They're saying, hey, it's that time of year again. It's time to get you enrolled. Is now a good time. And they're making it sound like they already have a relationship with her and it's something that she knows. I just feel like it's extremely misleading and maybe not technically fraudulent, but not the way we want our retired Americans treated. And luckily I saved my aunt. Now, I didn't save her from any terrible thing because they were going to enroll her in the plan that I'd already determined was the best plan for her. But they never asked what her doctors were. They never asked what hospital she preferred and where she lived. If you want this hospital, you got to get this plan. And if you want this hospital, you got to get this plan. So I'd already looked up her doctors and hospitals, which is how I came to the conclusion I wanted to put her on that plan. They didn't. They were just pushing that plan. They were just calling everybody and saying, hey, it's time to sign up for this plan. So then after she would have gotten it, she might have found out she couldn't go to the hospital she wanted to, which when it's a call center, maybe they don't care. You know, they're just trying to slap a bunch of policies up. So warn your clients about that. You think your clients love you and trust you and you have a long relationship with them, but they might think whoever's calling them works for you. And people are brazen. They might say, hey, I'm calling from your insurance agent's office and we want to get some new information for this year and just start going into it. And they don't ever say, oh, do you work with Mike Hopkins? You know, they just say, I work with your insurance agent. So you want to train your people, help train them to protect your relationship so that you can protect them. Medicare generally never calls you, and they're not going to ask your social security number. I had a guy that just got an $82 million fine from doing robocalls to people on Medicare, and he was calling over 200 people a day from his call center. One of the things that he employed was spoofing. And I know you've all been spoofed by now. Who knows what spoofing is? If you know what spoofing is, put it in the comments. I know you know what it is, but I don't know if you know what that word means. So those young people out there that know what spoofing is, let me see some comments about what it is. I guarantee you my dad does not know what spoofing is, but he's sick of it. And what it is you get a call on your cell phone that you don't recognize the caller ID, but it's from your area code. And so you trust it. It's got to be somebody from my town. In the old days, you know, if it was some area code you didn't recognize, you knew it was a telemarketer and you wouldn't answer it. That's the beauty of caller ID. So now spoofing makes it look like they're calling from right where you live and you're more likely to answer it. So spoofing has been great for those of us in the call center business because it's more likely that people will answer our calls. But it's more likely they're going to answer the scammers' calls too. So you got to warn people about spoofing. And that's what this guy that got fined $82 million got in trouble for, the robo-dialing, and then, of course, the fraud. So how do you protect your clients from that fraud? If somebody says, I'm from Medicare, chances are no. If they say, I'm a Medicare insurance agent, and I'm calling you to get this done, they may or may not be a Medicare insurance agent. Now, a lot of you are agents, and you cold call Meds Up, dental, vision, hearing, a lot of products, which is legal, except for Ohio. You can't call any Medicare product in Ohio. But in all the other states, you can cold call. You just can't call Med Advantage or Part D. So I don't want to say that cold calling is terrible. We're out there drumming up business, helping people and doing a good job. But we're up against these bad guys that are screwing it up for everybody. So you got to warn your clients about those people that are going to call and say, hey, it's that time of year again. I need your drug list to get you updated in the system. So how do you warn them? Well, if it's over the phone, they can say, okay, give me your name, your address, your callback phone number, and the name of your agency. Now, a lot of them, like I said, are kind of high tech. So they put up a fake whatever, or they maybe stole my identity. And they say, oh, I'm Sylvia Gordon. So you go online and you can see me and go, oh, she's legit. Most people aren't going to call the Department of Insurance or they're not going to go deep into this. Most people either fall for the scam or hang up. You know, it's one or the other. But if you're at least putting this out there, putting this in their mind, thank you, Adam, for watching. Do you know what spoofing is? Adam Rasmussen, I'm talking to you. If you put it in this mind that this is happening, you're a lot farther down the road towards helping your clients and saving your clients. I would have lost my own aunt as a client. She was going to sign up with a competitor because she thought she was signing up with me. How many times does this happen? You have no idea, especially when you've been in business a long time. You have too many clients. You can't find this out. You see some dropped off and you don't know if they moved or died or, you know, you have a big block of business. You don't know how many got scammed out of leaving you. So let's be proactive and put it in your newsletters and on your Facebook. Do Facebook live videos like this for your people and talk about some of these things. Talk about spoofing, you know, what's going on. Those of you that go and have face-to-face appointments still, that go to the home or have them come to your office, what do you think about these lanyards that they were giving out by Aetna in Nevada? Because I think these are really sweet. So it says Vern Barchtel. He's a great agent out in Las Vegas. And it said, learn more about Medicare. And it has Aetna. And then it has Aetna on the lanyard. This is something that I want to take you guys' pulse. That it would just say Sylvia Gordon, you know, Medicare specialist, my phone number, maybe my license number. Wouldn't be company branded, but it's something that we could provide for you guys so that when you go out to the house, you look more legitimate. And it's just one other step we can take to help differentiate you from the scammers. Because I would be interested in finding out what the ratio of scammers to actual legitimate, hardworking insurance agents is at this time of year. because the scammers are out in droves. Have you had any of your clients scammed? If you're on Facebook with me live, thanks for joining in. Give me a emoji, somebody crying. If you have had a personal experience with one of your clients getting scammed, I'd love to hear about it. You can get it in the comments. Are you reading the comments over there, Josh? Because I can't read Adam's comment. I'll answer you if I could read it, but Josh is supposed to be over here working. Lenny's over on the job too.
I can't read Facebook.
No, it's okay. So let me read this. Lanyards are awesome for in-home. I customized one about 4 years ago. Ooh, Adam, I want to see yours. Will you email me or text me a picture of yours? Because like I said, that's something we can provide for you guys if you don't have them, or we could juice them up or whatever. Wasn't a question. You're good. Oh, love ya. Thanks. Dad loves you too. Mwah, boom. Okay, so scamming is terrible right now, especially on the Medicare cards. They started coming out in April, and the way the government is sending them out, it's in waves. So right now, you guys get a lot of questions in the field. They're like, hey, my wife got her card, but I haven't gotten my card. Now, those people are sitting ducks for scammers, because the scammers call them and they say, have you got your Medicare card yet? And they know the waves. Like, I don't remember what it is, but the first wave in April was like 5 states. And then the second wave in May was 10 states. So they know what states to call that have not gotten their cards yet. And they say, have you got your card yet? And the people say, no, I actually haven't. I saw on the news the new cards were going to come out in April. Now, that was partially true. Medicare started sending out the new Medicare cards that don't have people's social security number, just a random generated 11-digit number and letters. But not everybody got them. They're supposed to have them by the end of 2019. So they can call the people that they know. I don't know where I am in the wave, where Indiana is, but if nobody in Indiana has gotten them, they just call everybody in Indiana on Medicare. You can buy that list, right? And they can say, hey, have you gotten your new card yet? We're just calling to make sure you understand how it works. And then here's my name. I'm Linda from Medicare. Here's my Medicare ID. And they sound real legitimate. And then they say, okay, if you haven't gotten it yet, I need this information to get a new one sent to you. Don't give it. Or I need $16. I can take a credit card right now, or if you do PayPal, to get yours expedited. They're free. Don't let anybody pay for these new cards. So again, this is content for you guys to go on Facebook. Don't do one long one like I'm doing, and do short little ones for your people. If you do use Facebook for advertising, and then ask your people, hey, share this with other people on Medicare, with other retirees, so you can help them. That helps you build referrals, and that helps other people, not become a victim to the fraud. So if you're getting something out of this video, if you're enjoying this beautiful time with me live, please give me a comment and let me know if you are having fun. If you're watching me on the rebroadcast, I love you too. I even love you more than the live people, because the live people weren't working. And you are working, which is why you're not watching me live. I see you. I see you. The Medicare cards are coming out in waves. So they're not done yet. So the fraud's not going to stop for a long time. If a husband turned 65 in April, he got the new card. So that's when the wife starts beating the doors down to you saying, he got his card, I didn't get my card. So make sure you realize that they can't call to get that card. They can't call you and say, hey, Sylvia, I know you said you take care of everything. Bob got his card, but I still have the old one. So can you give me my new one? No, you can't. There's nothing that you can do or they can do to speed it up. They have to wait until their wave comes. CMS has this schedule to get 70 million cards out. As you can imagine, they got to have a organized system. So if you're from Delaware and you're in the last wave, you're not going to be able to jump ship by calling Medicare 50 times. You got to wait till your wave comes. Now, you will have people, the cards look terrible. I mean, any business card is on a harder stock. Sarah Elmer, Humana. That's a good quality card. That's a way better quality card. And if Sarah, if you're watching, shout out to you. She's awesome. Than the Medicare cards that the government sends out to people for their federal benefits. It's a real flimsy card. So you can imagine there's people that think it's junk. and they throw it away with junk mail. So they were in the wave that already got it. They already got their new Medicare card, but they threw it away, or they lost it, or their wallet was stolen, or whatever. Now they can get it replaced because they're already in the wave that was allowed to get it. So they need to call 1-800-Medicare, and there's a system to replace the card, but only if they were already eligible to get the new card. The number one question I'm getting from agents in the field is, hey, how do I help my client get the new card? His wife has it, he doesn't, and they want their cards to match. And all I can say is wait till the end of 2019. Wait till everybody gets theirs. People aging in, every month if they age in, they get the new card. So if you guys have questions, let me know. Hit me up in the comments or email me at gordon@gordonmarketing.com. Thank you so much for your hard week of AEP sales. I hope you enjoy your weekend. What I really mean is I hope you're working all weekend like I'm working. And from my dad and the rest of us at Gordon Marketing, thanks for joining us. How long was it? And